Everyone, and welcome to the pre-layoff workshop for Nokia and Microsoft. Today we have three presenters who are going to go over some information to help you recover from your layoff. On the left-hand side of the webinar, you'll see we have a chat, and you can watch this or ask any questions throughout the presentation. And in the middle, you'll see the PowerPoints that each of our presenters are going to be using. And if you have any problems with sound, you can call into our conference number, which is at the top of the screen. So I'm going to pass it over to Kathleen to go ahead and get started.
Good morning. Hello and welcome to the Nokia Microsoft Rapid Response Webinar Workshop. My name is Kathleen Brannigan, and I am with the Chicago Cook Workforce Partnership. We appreciate your participation and hope that you will find this information useful to you in your employment transition period. The program today will cover the dislocated worker services, programs, and resources that are available to you through local, state, and federal grants, and has a myriad of resources that are all available free of charge to you. Before we get started, please note that the webinar is interactive and questions or comments that you may have can be facilitated through the chat function, and we encourage and welcome all of your questions. Additionally, information and materials for each agency that is participating today is available on the left lower side, and you'll be able to access that file. After each presentation, we will allow for responses to the questions and answers for the topic that was presented. Also, this webinar will be videotaped and available for viewing after today on the Illinois WorkNet portal site under the new layoff recovery site. Last, before we get started, as I mentioned, information and material that we present to you, the PowerPoint, etc., is available. The State of Illinois Department of Commerce and Economic Opportunity administers the state's rapid response and layoff assistance programs with our partner organizations, the Illinois Department of Employment Security and the U.S. Department of Labor. And we all come together as a rapid response team to present these available resources that are available through the Workforce Investment Act grants. And we present this information at companies and organizations throughout Cook County who have notified the state of Illinois of a mass layoff through a WARN notice letter. Again, my name is Kathleen Brannigan, and I represent the Chicago Cook Workforce Partnership, which is the local workforce investment area for Cook County and represents the public workforce system. The Dislocated Worker Program is a federal program available nationally through the Department of Labor and is administered through the Department of Commerce and Economic Opportunity. Here are some quick facts about the Chicago Cook Workforce Partnership, and I'm not going to go through each one, but the most important thing is that the partnership oversees the Workforce Investment Act grant and provides these services through 49 agencies, 10 workforce centers, and some affiliate sites. We provide workforce development services to over 140,000 people per year. One of these is for dislocated worker services. The goal of the webinar today is to provide information and resources on the dislocated worker programs to prepare unemployed individuals, people who've received notice of layoff, to reenter the workforce. Part of our job is to train workers facing layoff in new skills and place them into training-related employment. Most people are aware of the public education and public health care systems, but they are not aware of the public workforce system until an employment separation event such as this one occurs. Once again, the Workforce Investment Act provides dislocated worker services available through the Department of Labor WIA grant. The WIA grant provides employment assistance, employment placement, and related regional key sector training. One thing I want to point out is that if you are in receipt of a WARN notice or separation document, That will essentially serve as a ticket for eligibility proof to receive dislocated worker services. These services are available through the WIA grant, and this is a national program. So even if you do not live in Cook County, we will be covering the steps to locate a workforce center near you. Some information with regards to dislocated workers. Dislocated workers are individuals who have been laid off or terminated or received notice of layoff or termination due to plant closure or mass layoff through the receipt of a WARN notice. They are unemployed through no fault of their own and are eligible for unemployment and or unlikely to return to their previous occupation of industry. How does WIA help? The first level, there are 3 levels to the WIA grant: core, intensive, and training services. Let's begin with core services. Core services requires no eligibility requirement. That means anyone, your neighbor, your friend, your family member, can access the following listed services here through a resource room. Resource rooms are located at all workforce centers that are located in Cook County, and anyone can access the services here. One of the most important things I'd like to point out is that you can you can access a workforce center, and you have free use of computers with high-speed internet access, a fax machine, copiers, printers, etc., that are required for a job search. These services, again, the core service level, are available again to anybody, and you can use this location for job search. But if you are interested in accessing WIA services at the next level, which is intensive, you do need to go through an application process. Intensive services require that you attend a WIA orientation in the Workforce Center and complete the WIA application. This level of service will provide you with an opportunity to work one-on-one with a career or employment specialist who will assist and support you to maximize your job search. That entails a myriad of methods and activities for employment assistance and placement, and includes the main components of developing a job search plan, which includes your resume and cover letter development, how to navigate online job applications and prepare for job interview, and various dynamic methods for networking and job search through social media venues. I also want to mention that throughout the Cook County Public Workforce System and in all of the workforce centers, there are essentially small local workforce networks that are active and integrated with local partners, which also include the Illinois Department of Employment Security, city and community colleges, public libraries, and various employment assistance organizations. These are groups that you can work with directly. There are also many workshops that you can attend that will help you in your job search and prepare you for that next step, such as job clubs, networking clubs, mock interviewing workshops, etc. And you do see some of the things that are located that are detailed here. The important thing to note is that you must engage a myriad of different job search methods for the best outcome. The job search can be very isolating, and there's no reason to be. The highest level of the WIA grant is training services. It may be determined as you work one-on-one with your career employment specialist that in order to enhance your current skill level, or possibly you may determine that you want to change the chapter and move into a new occupation or sector, all meant to make you more marketable, you may need to go back to school for training. You may be interested in doing this. The WIA grant at the training level is meant for short-term occupational training and is focused on the key sectors that have been determined for our local workforce region. Those key sectors are information technology, healthcare, manufacturing, transportation and logistics, business and professional services, retail, and hospitality. Obviously, you can see that there are many to choose from. You may access training subsidies for that schooling, up to $8,000 in Cook County maximum. That doesn't mean that you'll be accessing or need all of those training dollars. It just means that that can provide subsidy to you. The other thing that I'd like to point out is that through the WIA grant, there are also supportive services for transportation and various school expenses such as books. The other very important tool that you can engage with is Illinois workNet. You've already engaged with Illinois workNet by registering for this webinar. And what I want to tell you is that Illinois workNet is an online workforce development portal that helps individuals plan and move forward in their job and career search. Dislocated workers can access the laid off worker company-specific page, in this case Nokia and Microsoft, on the Illinois workNet portal. On that portal, you'll be accessing the new layoff recovery site. You'll locate the company-specific page, and on that page it will provide a myriad of different materials and information that you will want to learn about. This tool, the Illinois workNet tool, is an online tool which is available to you 24/7, and it can help you prepare, it can help you learn and guide you in your employment search. Illinois workNet is provided to you through the state of Illinois, and all of the dislocated worker information that we present to you today is available on this website. Once again, I've referenced the Nokia Microsoft company-specific page, and on there you can access this webinar to go through it again. It will give you different materials such as the layoff package from the partnership that provides additional information. It will give you a launch to start a resume. It provides all the information about WIA. It's a complete resource guide. To access services in a workforce center in Cook County, you will need to locate a workforce center near you. And you do that by accessing, you'll see in this case number 7, that's the local workforce investment area for Cook. And you'll go on to locations, and you can narrow your search by entering your zip code. It will pull up one of the 10 workforce centers that are located throughout Cook County in the city of Chicago and suburban Cook. The other thing that I'd like to cover is that on the Illinois workNet portal site, you can also access information with regards to health insurance and prescription benefits that are available through the state of Illinois as you go through this transition. Again, this is available on Illinois workNet under supportive services. The last thing I want to mention is there is also a survey that is available on the recovery site that we ask that you access and complete. This will help us help you as you move through this transition of reemployment. I'm now completed with my presentation, and I'm going to check for questions. We've provided access on the website for the survey there, and complete that again on Illinois workNet. Joining us, thank you for accessing this information. And our next speaker is Lisa, and she is with the Department of Labor. Thank you.
Good morning. My name is Lisa Stromek, and I'm a benefits advisor with the Chicago office for the U.S. Department of Labor, Employee Benefits Security Administration. We enforce the Employee Retirement Income and Security Act of 1974, or ERISA, which offers protections for both health and retirement benefit plans sponsored by private sector employers. And today we will go over some of the protections under ERISA and the related laws which have amended it so that you can make the best possible choices for your particular situation. Oh, please excuse me, I actually forgot to advance the slide that will give you an idea of who we are and why we are here today. So in the next slides, we will go over some different options for health coverage, including the HIPAA special enrollment, COBRA, the young adult coverage now available thanks to health insurance reform, and of course the health insurance marketplace. So HIPAA, or the Health Insurance Portability and Accountability Act of 1996, is the law that has offered protections to participants who switch from one plan to another. And under health insurance reform, plans may no longer impose pre-existing condition exclusions on participants. And while the certificate requirement will soon go away, HIPAA certificates of creditable coverage must still be provided through the end of this year so that individuals who may need to offset a pre-existing condition exclusion under a non-calendar year plan would still have access to a certificate for proof of coverage through the end of 2014. And the HIPAA certificate will also list the date that your active employee benefits ended, which can be as soon as midnight on the last day of your employment, but may also continue through the end of the month or the end of the pay period if your coverage was already paid through a later date as an active employee. So that HIPAA certificate is still something you can expect to receive in the mail, and it will give you certain information that can be useful to you, especially if you're not certain when your benefits may be ending. And one other addition to HIPAA under the health insurance reform is that now when enrolling on another employer-sponsored group plan, coverage must be effective no later than 90 days after a new employee satisfies the plan eligibility requirements. So in other words, there can't be waiting periods of longer than 90 days now for a subsequent employer's plan. As an alternative to COBRA, another provision of HIPAA allows someone who qualifies for another employer-sponsored plan but previously declined coverage under that plan to now enroll in this plan outside of any open enrollment period following a loss of coverage. So this can actually be a cost-effective alternative to COBRA if the other employer-sponsored plan, such as your spouse's employer's plan or a parent's employer's plan, if you are younger than age 26, pays a portion and shares the cost of the health insurance premiums with you. And I'll go into some of that in more detail when I talk about COBRA and young adult coverage. But when you're an active employee, a lot of times your employer will do a cost sharing, and so you don't actually pay the full amount. You may pay a portion of it through your paycheck deductions, and that's why HIPAA special enrollment, if you have this option available to you, could be a good choice. And when you choose to request enrollment under HIPAA special enrollment, the coverage under that next plan must take effect no later than the first of the month after the special enrollment request is made. So even though you have 30 days to notify, remember to request special enrollment before the start of the coming month if possible to avoid a possible longer break in coverage than is necessary. COBRA is something that's often used in conversation as a plan of insurance or a type of coverage, but is actually the name of a law passed in 1986, which allows you to continue the same group health plan on a month-by-month basis for up to 18 months at your own cost. And because COBRA is a direct continuation of the same plan that you had as an active employee, everything about the coverage stays the same, including your proof of insurance card, your doctor or provider network, and any progress you've made towards an annual deductible. And COBRA does allow independent elections, so if your employer offers medical, dental, and vision coverage as separate plans, you can elect to continue just the medical but not the dental, or vice versa. However, one thing that can and usually does change with COBRA is the cost you are used to paying for the coverage. As I mentioned before, normally employers may cover a portion of the premium for active employees and then deduct the rest from your paycheck. But under COBRA, they can pass along to you both the employee and the employer cost plus a 2% administrative fee. But there are ways to reduce the cost through what is called independent election rights. So just as you can continue to choose the dental plan but not a vision plan and not the medical plan and only pay for what you select, if you have family coverage, you'll be offered the ability to continue the family coverage as you had it. But you may choose to continue coverage for just one family member rather than the whole family, and then the amount that you pay will depend on what you elect also. So you may be able to choose to pay just a single rate instead of the family rate and then look for coverage elsewhere for other family members if there is one particular person in your family who already has met a deductible or needs to stay with the same doctor network and so on. So you will actually receive a notice in the mail with all of the information you need to make up your mind about the COBRA, including the monthly cost and where to send your payments, and that notice should arrive within 44 days. And this election notice can usually be a packet, and it will either have a return address of your employer if they administer COBRA continuation in-house, or it may have a return address on the envelope of a third party that they've hired to take care of compliance for them. That's usually a payroll service company such as ADP, or maybe a specialized COBRA service provider such as COBRA Source or COBRA Serve. So make sure to look for that in the mail. And if for some reason you don't receive it, you can keep in mind that you do have 60 days to make up your mind about COBRA, starting from the later of the date that your active employee coverage ended or the date of the notice. And we always encourage people to contact us at the Department of Labor if they need any help to obtain a COBRA election notice. We can do a call to your employer, or you can, if you have the number to your Human Resources Department, you can just contact them on your own and check in about that if you don't see it within the 44 days. You can also not be required to send in payment with your election, and if you do elect COBRA, you'll have an additional 45 days to make your first payment. So depending on how long you take to elect and how long you take to send in your first payment, you could end up owing for something like 3 months of coverage up front. And then going forward, your payment is generally due by the first of the month in which you will receive the coverage, but it is considered within grace period if your payment is received within the 30 days of that month. And also another thing to keep in mind is that the sooner you elect and pay for COBRA, the sooner your benefits will show as active again. And because of the administrative time delay involved with sending the notice and the time you have to make your decision, in the meantime, your coverage may show up as temporarily canceled until your payment is received and posted. So if you know that you have some kind of procedure or doctor's visit coming up, you may want to, speed things up on your end so that your coverage can show up as active as soon as possible. But COBRA always goes back to cover you to the date that your active employee benefits ended, leaving you with no break in coverage in the end. So looking back, it will appear as though there was never a break, and then you shouldn't have any problems submitting any claims that you may incur out of pocket for reimbursement later on. And another thing that people can try is there's really nothing they can do to speed up the election of COBRA or the processing of your COBRA election so that your coverage shows up as active, but you have these appointments scheduled, is to just chat with your doctor's office and be open with them. Let them know you're in the process of electing COBRA and see if they're willing to work with you and hold off on billing your insurance until it shows up as active again. And thanks to health insurance reform provisions, or Obamacare as they are sometimes called, one of the new requirements is that employers allow adult-dependent children up to age 26 to join or remain covered on the parent's plan. And this is even if that adult-dependent child is married, financially independent, and not living with their parents, or not a full-time student. A lot of times, they're even eligible to enroll on a parent's plan even if they have eligibility for coverage through their own employer. But unless, this is not going to be an option if the employer's plan has something called grandfathered status. And again, this will only really apply to you as an alternative to coverage if you are age 26 or younger. But it does, I do like to mention it just in case, and these rules do apply to both job-based plans and any individual plans you can buy yourself inside or outside of the health insurance marketplace. And adult children may be enrolled during a plan's open enrollment period or during other special enrollment opportunities. So again, this kind of ties it back to what HIPAA allows in the event that someone has a loss of coverage. Instead of special enrolling onto a spouse's plan, if you don't have that eligibility, if you are eligible to enroll on a parent's plan, that is something that you can request special enrollment of. And finally, some other options that we have now include shopping for coverage through the new health insurance marketplace. And while it is still possible to apply for financial need-based coverage directly through the state or to purchase individual coverage directly through an insurance company or broker, now we have the ability to shop through the marketplace. And the benefit of that is that you will go through a screening process, automatically evaluates you for any financial need-based coverage available through the state or for the premium assistance or tax credits available to help offset the cost of marketplace plans to individuals. And those premium assistance and tax credits, those are only eligible or available, to people who don't have access to plans sponsored through an employer. So if you have no other options, looking at the marketplace could be a good thing to do. And this slide goes over some basic facts about shopping for coverage in the marketplace. In addition to visiting healthcare.gov or calling and speaking with a health insurance navigator at the 1-800-318-2596 number shown, Illinois residents can also purchase coverage by visiting getcoveredillinois.gov or by calling 866-311-1119. And that phone number is available Monday through Saturday, 8 a.m. to 8 p.m. We do have a new open enrollment period coming up for the federal health insurance marketplace. Outside of open enrollment, it's kind of just like an employer plan. You really need a special enrollment opportunity such as a loss of coverage or a life event in order to enroll outside of that open enrollment period. But at this point, anyone can sign up from November 15th of 2015. Oh, I think that should be 2014, through February 15th of 2015. And examples of qualifying life events would be something like moving to a new state, certain changes in your income, and changes in your family size due to marriage, divorce, or the birth or adoption of a new baby, and in addition to a loss of other coverage. So one thing that people may do is decide to go with COBRA, and then they may kind of, after a while, decide that it's too expensive and then look to change to marketplace coverage. And what I want to bring up about this is that It really can only be done during the marketplace open enrollment, even if COBRA coverage hasn't run out. And so you can always choose to special enroll, but because of the timing of this new open enrollment period coming up, you could use that to your advantage. And if you decide that you're not happy with the COBRA continuation, you should be able to do it during the open enrollment period that's coming up. But otherwise, it's really not possible, and someone would have to actually exhaust the full 18 months of COBRA before they can decide to enroll on the marketplace. So one of the options offered through the state is Medicaid, which is free or low-cost care based on income and family size. And this is something that you would automatically be screened and directed towards by either shopping for coverage through the federal marketplace or the state of Illinois marketplace. And if you qualify, your coverage can begin immediately. And there are no restrictions for the time of year that you can enroll. And another option is also the Children's Health Insurance Program, and this is something that's available to people who do not qualify for Medicaid because of income. But it is also another low-cost health coverage option, and it will cover parents and pregnant women in addition to children, despite the name. And just to be aware, every state program has its own rules and qualifying guidelines. In addition to just learning about that through the federal marketplace, you can visit their website at www.insurekidsnow.gov or call the number that's shown here on the slide. And that is all for health insurance. Finally, we would just like to offer some brief but important retirement plan reminders. And regardless of the type of plan that you may have through your employer, it is a great idea to keep your address updated with the plan if you move, so that you can continue to receive plan mailings and the plan knows how to find you when it comes time to pay benefits. A lot of times when you're separating from service with a company, it may seem like there's no reason to keep in contact with them, but I do hear in my daily work from a lot of people that call in, and they've left employers many years ago. The companies may have reorganized somehow or been purchased and or gone out of business, and then they're really struggling to try to track down their retirement plan benefits. So it's a good situation to try to keep yourself out of. Normal retirement age for full benefits, of course, is usually age 65. But different plans offer different options, and just like health plans, retirement plans must be administered according to a set of written rules. And so if you don't already have a copy, one thing you may want to do before the end of your employment is to ask Human Resources or Benefits for a copy of the written rules, and the formal name for this document is a Summary Plan Description, or SPD for short. And employers may still offer pension plans, although it is a type of plan that is no longer as common. With this type of plan, benefits are payable only at age 65, sometimes at a reduced amount at an earlier age, and you're not going to be getting any sort of individual account statements. The benefits are calculated based on a formula that takes into account the number of years of service that you had and the age at which you retire. But the more common types of plan that we see today are called defined contribution plans, and this is something like a simple IRA or 401k, and you do tend to receive account statements. So if you do receive them now, you should know that your options are, with this type of plan, to keep the funds there in the plan and just make sure you keep in touch with them. Or you may be able to roll it over into an individual retirement account or your new employer's plan if that's allowed. You also have the option a lot of times to take a taxable distribution, but of course there is a tax penalty on top of paying any tax that you may not have already paid on those pre-tax dollars that were paid into your account. So it is something to think about if you are considering doing that. And finally, I'd just like to leave you with our contact information. I mentioned that I do take phone calls from the public. Usually they reach us by calling this toll-free number if they have any questions or concerns regarding health or retirement benefits or the laws that protect you. You can also visit our website for more information. And we do have a web inquiry system now, so if you would like to send us any questions via the web, we will respond back to you and contact you by telephone to address your questions. And you can also look for a brochure. It's red in color, titled Retirement and Healthcare Coverage, Questions and Answers for Dislocated Workers. It's something that we usually hand out if we do give a presentation like this on site, but it is available for download in the resources and also on our website. So at this point, I'll just see if there are any questions.
Thanks, Lisa. Just to let the participants know, if you have any questions for our presenters, just to remind you, you can put those in the chat pod on the left side of the screen. I didn't see any questions come in regarding Lisa's presentation, so we can go ahead and hand it over to Abraham. But if anyone thinks of any other questions, you can always put that in the chat, and our presenters are going to be here for the remainder of the webinar, so they'll be able to answer them.
Yes, thank you very much, and good luck to everyone.
Well, hello, everyone. My name's Abraham Elizondo, and I represent the Illinois Department of Employment Security. A lot of people know us as the Unemployment Office, but we offer more than just unemployment insurance benefits. For purposes of this morning, I'll be discussing two topics, and that's the Unemployment Insurance Benefits Overview and Illinois Job Link. Now, I will tell you that I understand this is a recorded session. If you have any questions about this presentation or you have questions as a result of this presentation, we have claimant services that is available from 8:30 to 5 that can answer any and all of your questions. Anything that I'm presenting today, they are more than able to tackle those questions. And that claimant services number is 800-244-5631. That number again is 800-244-5631. Alrighty, so let's get into the Unemployment Insurance Benefits Overview. Unemployment insurance is a state-operated insurance program designed to partially compensate you for loss of wages when you are out of work. Like fire and accident and health and other types of insurance, it is for an emergency and designed to provide workers with financial assistance during temporary periods of involuntary unemployment or underemployment. Now, the program ensures that if you meet the eligibility requirement of the law, you will have some income while you're looking for a job. And it's up to a maximum of 26 full weeks in a one-year period. Again, that's up to a maximum of 26 full weeks in a one-year period. Unemployment insurance should not be confused with Social Security benefits, which is a totally entire agency. Whereas you pay for Social Security partially through payroll deductions, unlike Social Security, you do not pay any part of your wages either directly or through payroll deductions for unemployment insurance in Illinois. Now, IDS collects unemployment insurance taxes from the state liable employers and returns those tax dollars or returns those dollars to eligible Illinois workers as unemployment insurance benefits. And again, workers do not pay in to the unemployment insurance benefits. Now, let's talk about monetary eligibility requirements. Now, in order to be monetarily eligible, you must have been paid $1,600 or more in wages during your base period for insured work. Now, we'll get into what a base period is in just a moment. Now, in addition to the $1,600, you must have been paid at least $440 of your base period wages at any time during the base period outside the calendar in which your wages were the highest. Now, your base period. Your base period consists of the first 4 of the last 5 completed calendar quarters immediately preceding the beginning of your benefit year. And then your benefit year begins the date of your first valid claim. Now, I understand for Nokia and Microsoft employees, you expect to be laid off around mid-November. Now, this chart that you see here is a little bit out of date, but if you look at the second line, I don't know if you can see that I'm pointing to quarter 4 of 2013. That should be actually quarter 4 2014, because that's when you're going to be filing for benefits. What we do is we look to see what you've earned in the third quarter in 2013 through the second quarter of 2014. So, and that would be basically, if you're looking at your base period from months, it would be last year between July 1st and December 31st, 2013, or 2014, through this year, January 1st, June 30th. Now also, as I mentioned before, we look to see what you've earned in the first 4 of the last 5 completed calendar quarters, and that's what we consider your regular base period. If you have insufficient wages to establish a claim using the regular base period, then we may look at wages in the alternate base period, or rather we look at the last at 52 weeks prior to the date of claim. Now, let's talk about your minimum and maximum benefits, which is really one of the most important things that you want to get out of this. Now, your weekly benefit amount depends on the amount of wages for insured work paid to you during the highest 2 calendar quarters of your base period. And regardless of how much you were paid in your 2 highest quarters, the total amount payable to you for a week cannot exceed a legislatively set maximum amount. For this year, 2014, the minimum that you would get if you're just filing for yourself is $51. The maximum is $418. Now, if you are claiming yourself and a non-working spouse, then your minimum would be $66 all the way through $498. If you have a non-working spouse and a child, I would recommend, highly recommend that you claim your child who is under the age of 18, because you see that that's where you would get the most benefits. Minimum is $77 and the maximum would be $569. Now, those would be what we just discussed were your monetary eligibility requirements. We also have non-monetary eligibility requirements that you have to meet. Now, with the non-monetary eligibility requirements, you must have been involuntarily unemployed or underemployed. You must have been available and actively seeking work, and I'll get into those three terms in just a moment here. You must also complete registration at IllinoisJobLink.com, and that's the second presentation that I'll be talking about. You must also serve one waiting week, and I'll discuss that a little bit shortly. And you must certify for benefits every 2 weeks without fail, because if you fail to certify, then you're not going to receive those unemployment benefits. Now, when and where to file. Now, you must file your claim for unemployment benefits during the first week after becoming unemployed. And you can apply for unemployment benefits online or at a local IDES office. We no longer take paper claim applications, so if you have a computer and you have access or connectivity to the internet, I would totally recommend that you go to our website, www.ides.illinois.gov. And of course, it's available, 24/7. Also, to find your local office, you can visit our website or you can call our claimant services. And again, this number is the one that I gave out in the morning, 800-244-5631. Now, local office hours are Monday through Friday, 8:30 to 5, and with the exception of holidays. what you will do if you don't have a computer, then you can use our resource room to access our website and file your claim online. Now, information needed to file your unemployment claim. It's very important that you have your Social Security, your driver's license, or your state ID in front of you when you start filing your claim online. Obviously, you know your Social Security number, but you also need the data from the driver's license or the state ID, because you'll need the license number or the state ID number. And you have to enter the information exactly like you see it on your ID or driver's license. Another thing you'll need are the names, addresses, phone numbers of all your employers you've worked for in the past 18 months. And then you must also include the number of days, and this slide doesn't have it, but we also need the dates of employment for each employer that you worked for in the last 18 months, and the reason or reasons for separation from each of those employers. Also, we need information regarding any pension or retirement payments that you're receiving, which includes Social Security benefits, just a regular pension that you might be getting from Microsoft or Nokia. If that is pertinent to you, then of course you would have to include us or provide us with that information. Now, if you're claiming your spouse to get that dependent allowance, then we would need your non-working spouse's name, employment status, and Social Security number, along with the date of birth. If you're claiming a dependent child, we need the child's name, birth date, and Social Security number. You might be able to get away with, if your child is a newborn and they don't have a Social Security number, you know, we understand that obviously that newborn is not going to have a Social Security number, but if you do have it, provided to us. In addition to the dependent child, you can also claim a dependent child that is over 18 if that dependent child has a disability, and you'd have to provide us with documents that the individual or that your child is disabled and totally under your care. Now, what happens next after you file your claim? Well, IDES will send you a statement, okay, and it's called the UI finding letter. Now, this UI finding letter includes the wages that were reported by your employer in each calendar quarter of your base period. The base period is what I talked about earlier in the presentation. And it's got to be for insured work and the total wages paid to you during your base period. Now, along with that, we will give you your weekly and maximum benefit amounts. Well, WBA stands for weekly benefit amount as opposed to the MBA that stands for maximum benefit amount. And any dependent amount would be listed on there. We will also provide you with the payment type, whether you elected direct deposit or debit card. We will automatically send you a debit card because oftentimes what happens is when you file your direct deposit information, your account for some reason or other may be terminated, may be closed or whatever, but always we will send you a debit card. It's your responsibility to make sure that you maintain it, that you activate it, and just keep it in a safe place if you elected direct deposit. The UI finding letter will also contain your first certification date. Now, you cannot receive benefits for a week until you have certified for that week and have met all the eligibility requirements during that week. Like I mentioned, you're required to certify every 2 weeks. Failure to certify for benefits will result in you not receiving those unemployment benefits, and you'll have to pay a visit to your local office to find out why it is that you didn't certify. And benefits are paid for calendar weeks of unemployment. So a calendar week begins on Sunday and ends on Saturday. Now, certifying for benefits. Let me get into this. Now, once you file for unemployment via the internet or at the local IDES office, you must certify to your eligibility for benefits by internet or by telephone on your scheduled date every 2 weeks to IDES. Now, on the UI finding letter, it's very, very important that you look out for that certification date. It'll tell you when your first certification date is, and then you'll have to certify every 2 weeks. Now, the first eligible week of unemployment, or the week of benefits following an initial claim, is referred to as a wait week. One of the number one questions that we get is, I certified for 2 weeks, and why didn't I get paid that first week? Although you certify and you meet all the eligibility requirements for that wait week, it will not be paid. That first week is not paid. And so if you have any questions about that, again, you can contact Claimant Services. Now, certifying for benefits, as I mentioned earlier, the best way to certify is via our website. Everything is done now via the internet, and you can go to our website at www.ids.illinois.gov, and you can select the unemployment insurance under the Individuals tab, and then choose Certify for Weeks of Benefits. A lot of people like to do it by telephone. A lot of people, aren't computer savvy, and they choose to do it via the telephone. IDS uses a touch-tone voice response system called Teleserve, and the number is also listed in the UI finding sheet, but it's at 312-388-4337, and it's available from 5 a.m. to 7:30 p.m., and that's when you would call on your scheduled date. Now let's talk about able and available and actively seeking work. Now during each week, you must be willing, ready, and able to accept a suitable job, and you must be able to and available for work. Now the law states that you must be able to and available for work during any week for which you claim benefits. You are not able and available to work if you are sick and cannot work on any day, you are away on vacation, you must stay at home to keep house or care for your family, you have retired and will not accept a suitable job, and so forth and so on. There are various reasons. Now, the law states that you must actively seek work on your own initiative. Keep a log of your job activities or your job search activities for every week in which you claim unemployment insurance benefits. If your eligibility is challenged, you may be required to produce that document. Save your written records of documenting your work search for any weeks being claimed until 1 year has passed from the end of that week, because oftentimes a lot of employers may challenge those eligibility. And a work search form is available on our website, and if you apply in person, you will receive a work search form from the local office personnel. Now, partial benefits for part-time work. You may claim partial benefits for a week even if you find part-time work. You must report earnings from part-time work when you certify. Report gross wages in the week earned, not received. So for instance, if you worked November 1st, or let's just make it realistic, from November 2nd through November 8th, and you don't get paid until November 24th, you would then state that you worked from November 2nd through November 8th. It doesn't matter that you got paid 2 or 3 weeks later. You would report the week that you actually worked. Now, earnings in excess of 50% of your individual weekly benefit amount, but still less than your weekly benefit amount, not including the dependency allowance, are deducted from your weekly benefit amount, resulting in partial benefits. Now, if your wages for the week are equal to or greater than your weekly benefit amount, your wage deduction eliminates your benefit for that week. However, that week remains in the maximum balance. And again, dependent allowance is payable only if benefits are payable. Now, payment options, as I mentioned briefly, you will automatically get a debit card. When you get that card, make sure you activate it and keep it in a safe place, even if you've elected direct deposit. Now, electronic payments are generally available 2 to 3 business days after you certify for benefits. After you file a claim, as I mentioned, a debit card will be sent to you. Unemployment insurance benefits are subject to state and federal income taxes, so just be aware of that. Dislocated workers, I'm not going to cover this slide because I believe Kathleen mentioned that in her presentation. But the only thing that I do want to mention is the third sentence. It is important to register with your WIA provider as soon as possible, as soon as you become unemployment benefits, so you can access those WIA benefits. And Illinois Job Link. The link to Illinois Job Link is www.illinoisjoblink.com. I know that the presentation has https://illinois.glink.illinois.gov, but if you just type in illinoisjoblink.com, it'll redirect you to the same website. Now, Illinois Job Link is an internet-based job search resource tool. It's not the tool, it's a tool for posting and finding jobs in the state of Illinois. Now, you're required to register at Illinois Job Link when you receive unemployment benefits. Now, failure to register could delay or stop you from receiving those unemployment insurance benefits. Now, this is an internet application available anywhere you have internet access, and help is available in every local office resource room. Frequently asked questions can be found on the website as well. And this is a perfect segue to get into the next topic, Illinois Job Link. Now, Illinois Job Link. There are many benefits to Illinois Job Link. Now, the benefits are that it's no cost to you. And most importantly, it allows employers to connect with you based on keywords on your resume. And it's easily, you can easily update your information and save multiple resumes to target specific jobs. If you have one resume, it's not a good idea to have just one resume. You must tailor your resumes to those specific jobs. And obviously, it's very important that we mention here that Illinois Job Link is available 24 hours a day, 7 days a week. Now, let's set up your Illinois Job Link. When you go onto our website, you'll see this main menu. Now, since this PowerPoint was created, this right here, and again, I don't have the arrow to show you. On the left-hand side, it says, find a job and create an account. What we want to do is you want to go on the right side. If you've got your login information, you would enter your username and password. And if you've not registered, where it says not registered, right underneath it says job seekers. That's where you want to go to click on there. And once you click on job seekers, then you'll get into the creation of your account. It guides you, the job link guides you through creating the basic account, and that's where you can perform advanced job searches and save your searches as well. You can build and post an online resume. The great thing about Illinois Job Link is that if you've never created a resume, all you need to do is just provide us with your data, and it'll automatically build your resume online. You can also receive email alerts about job openings, and you can create a Plus account. Now, when you create a new account, you'll get this screen about your Social Security. You are, of course, you may decline entry of your Social Security number, but I want you to keep in mind that if you elect not to provide us with your Social Security, it could prevent you from receiving some unemployment insurance benefits, because what we do is we match your benefits with to see if you're actively performing your job searches, your required job searches. Just be aware that your Social Security number will be maintained in a secure and confidential manner, and it will not be released without your express consent. Now, creating your Plus account, as I mentioned, is free and will help the Job Center staff match you with your ideal job. Once you create that Plus account, you can do anything by, from adding to editing your Plus account on your home page. Now, if you've indicated that you're on active duty with the Armed Services, or you're the spouse of a veteran, JobLink skips this page and leads you directly to the first page of the Plus account. All veterans will automatically get that Plus account creation. And finally, after you build your registration as you complete it, it'll take you about 15-20 minutes to complete it, and it'll say your Job Seeker Plus account registration is complete. If you don't see this important message on your screen, then you did not complete it. You probably left out some information. But you'll see this page that says your registration is complete. Congratulations, so forth and so on. And that is all I have. Again, I just want to reiterate, if you have any questions about any of the information that I just went over, and I understand that some people are not available, you can contact Claimant Services at 1-800-244-5631. Thank you.
Thank you very much, Abraham. And thank you to all of our other presenters that were able to share this valuable information with everyone today. That was all we had for the pre-layoff workshop webinar for Nokia and Microsoft. We are going to go ahead and sign off, but we will leave the chat up in case you have any last questions. And we will post this to the Illinois WorkNet Layoff Recovery Nokia Microsoft page. So if you want to download the materials if you weren't able to yet today, or to view the recording, you'll be